All right. So we're going to talk for the basic surgical instrument that we need. So this is Minnesota retractor. Minnesota retractor. It's very useful in oral surgery. We use it for cheek retractor, tongue retractor. Also, when I open the flap, this edge can help to protect the flap for reflection, and very useful in third molar surgery, especially lower third molar surgery when you have to cut the bone, cut the teeth, and protect the soft tissue. So this is Minnesota, one of the basic retractor oral surgery. Blade handle, we use number 3. This is the essential for oral surgery. Bone file. This is the bone file. It has 2 edges. And usually to round the bone after extraction, after big surgery, we don't have to leave any sharp edges on the bone, because sharp edges, when you suture over sharp edges, that will interfere with healing, also with pain. So as much any surgery, you have to remove any sharp edges from the bone. So this is bone file. Periosteal elevator. Periosteal elevator, there are many types. This is number 9 that we use, and very useful to separate the gingival tissue around the tooth, reflection of flaps. Very useful in many ill traction, and the basic oral surgery. You need periosteal elevator. Also, you need the needle holder. This is the needle holder. Usually it comes with the bear with the scissor, but also this mosquito tissue forceps. Will hold tissue, useful in suturing. Can hold assistant can help hold the needle. Also help if the tooth is too loose and you don't have to grab it with the forceps. You can use it with this one, with the root tips. When you separate the teeth, you can use this tissue forceps. For the instrument, whenever you see an angle, this is a lower. Whenever there's angle, this is a lower. When there's an angulation, there's lower. And this is lower, this is lower, this is lower. Whenever there's an angle, this is lower. Even this one looks straight upper, but has angulation, so it's lower. It has lower. This is mostly for wisdom tooth, lower wisdom tooth. It can be used for upper, but mostly we use it for lower instrument. So these, whenever there's angle, it's useful for lower anterior teeth. This is lower anterior teeth. When the peak or touch, this is for lower anterior teeth. When there is a gap, mostly larger teeth, which is canine, premolars, and sometimes we have the one with the, you can see a peak here, peak or a sharp notch here. This will go in the bifurcation area for lower molars. So this will fit lower molars. Okay, when you see there's a peak here or a sharp edge that goes in the bifurcation, that will hold the lower molars. All anterior, almost all upper forceps, they are almost straight, and they have some type of curvature to adapt for the lip. On the whenever you go posteriorly back in the you will have more curvature. So if it's straight, this is for upper anterior teeth. Here from the canine to the canine, central, lateral, canine, you can use this. When it has a little bit, when it has a little bit curvature, mostly for premolars. This is for premolars. Yeah, this is for premolar because the curvature to avoid impinging the lip, because we're going back to the mouth. And the curvature will increase. That's most likely for can you see the peak? This is for roots. That's most likely for wisdom teeth. And when you try to separate the roots of upper first molar, second molar, even the third molar, this one is very useful for to grab the roots, because can you see the peak of it? Yes. Thank you. So this one It's upper because it's straight and has a little curvature, so it's more posterior. And you can see there are one side has a peak, the other side has a just an arch. This is for upper molars. Upper molars, they have trifurcation, not bifurcation, trifurcation. There's an opening on the buccal side. So whenever there is on the buccal side, you can tell the peak will go on the buccal side always. So there is always left to right for these. We'll wait together. Okay. We'll talk about sutures. There's polygonal acid. There's absorbable, non-absorbable. You can see the curvature, the needle here. This is the size of the needle. This is the cutting. This is a cutting. It's not round. You can see there's a triangle, so it's a cutting, and you can you can tell what you're gonna need the suture. Maybe we can do one lecture. It's all about needle. Okay, elevator. We have straight elevator. This is straight elevator. Apexo elevator for the apex. Okay. This is spade. Also can be used as a straight elevator. It's not straight. It's apexo as a more. It can work as apexo, but also I can use it to move the teeth to the. Almost all these that we have now. So we can talk next time. Thank you.